Hi, I'm Dr. John Young, medical doctor here in St. Petersburg, Florida. When I left my training up in West Virginia at Marshall, where I trained in family practice, I'd come down to Florida and I'm thinking, Floridians, why even check vitamin D levels? You know, we would do that up in West Virginia. We live in the Sunshine State. No one's going to have low vitamin D levels. And lo and behold, as I would check my patients for vitamin D, probably 80% of them had low vitamin D levels. And what I've discovered is that we're so programmed to wear sunblock or clothing to protect us from the sun that we really don't absorb that much vitamin D, which we get from the sun. So I started just really getting into this. Why is vitamin D so important? And I started reading a lot of books, and then I met a fella named Professor Hollick, Michael Hollick, there at Harvard, who's head of the Presidential Commission on Vitamin D. And he really taught me what I know about vitamin D. And basically this, first of all, it's not a vitamin. It's a hormone. Every single cell in your body has a vitamin D receptor. Vitamin D is very important for how we make energy, how the mitochondria works. And if you don't have enough vitamin D, the body is not going to function properly. I was talking to him one day and I said, and we were just talking about our family, and I said, you know, it's very interesting. My son, he's about 5, 6 years old, and you know, in the evening before Karen and I go to bed, we come upstairs and there he is in our bed sleeping. And we'd wake him up and put him in his bed, and the pillow would be soaked. And his head would be all hot and sweaty. And Professor Hollick said, John, that's a sign of vitamin D deficiency. When the brain has low vitamin D, it's very irritated and it will sweat. So I gave Jonathan about 100,000 units a day for 3 days of vitamin D, and it went away. So I was also surprised that here, it's my own son, and he was low on vitamin D. Now, it's a blood test, and the normal range is anywhere from 30 to 100. You need a level of at least 30 to prevent rickets. There are studies from World Health Organization. You need levels over 60 just to act as somewhat of an anti-cancer protection. So there's different ranges for vitamin D in the body. The other thing is I found out that if you live north of Atlanta, longitude of the parallel, whatever it is, of Atlanta, from November to, I think it's the 1st of April, you make really no vitamin D from the sun because of the angle of the rays of the sun hitting the earth. So people need to supplement. Now, I use higher doses of vitamin D because I learned from the professor that when you do higher doses, you will be surprised at what it does. And what I've done is I will order a blood test to get a basic vitamin D level. And then I will give a shot of 100,000 units of vitamin D, and that raises that blood level by about 10 points. For my patients, I will also check a calcium level because I want to make sure the calcium level does not elevate. In some people, about 10% of white females, middle-aged white females, people with sarcoidosis, people with parathyroid hormone disease, vitamin D in larger doses can raise calcium levels. So you want to be careful. And so I get a calcium level, and then I will give them a shot of vitamin D. I will start them on about 20,000 units of vitamin D a day for a couple months. And each time I give them 20,000 units a day for a month, it raises the level by about 10 points. I like to then give them a baseline dose, and I will give that anywhere between 5 and 10,000 units a day thereafter. If you're growing, if you're in a lot of stress, a divorce, a lot of young kids, getting chemotherapy, you're going to go through vitamin D like it's candy. So I want to keep those levels up. So I will give a lot of my patients levels of 5 to 10,000 a day. And then, you know, after a few months, I'll check those levels and my calcium levels to make sure that they're not becoming toxic. And by toxic, I don't mean that it's over 100 on the lab test. I mean where the calcium levels are elevating. I have found, and I've learned this through my patients, that for a lot of my rheumatoid arthritis patients, if their vitamin D level is over 150, they have no pain. A lot of them are off their meds. So this idea of you can really get in trouble because of high vitamin D levels, yes, you need to watch the calcium, but it also makes the immune system better. My daughter, Down syndrome, we were told by the doctors she's going to have a lot of immune deficiency problems. She's going to be on antibiotics pretty much every month for the rest of her life. Oh yeah, she's 8 years old now and really never been on antibiotics. But her blood level for vitamin D is about 233. It makes the immune system better. So I love vitamin D because it really does modulate the immune system. Yes, everyone says, I need to take vitamin C for a cold. I agree. But if you want to really see yourself get better from a cold quickly, do this. You come home from work and you're like, got that scratchy throat, not feeling so great, would like to lay down, let the wife take care of the dinner and you kind of rest. What I'll do is right before I go to bed, I'll do about 50,000 units of liquid vitamin D. I like liquid vitamin D. I think it's better absorbed than the pills. Very often the next morning, my wife is saying, well, how you feel? Oh yeah, I wasn't feeling so good last night. Feel great. It jump starts the immune system. So just wanted to really put this information out to you, run it by your doctor. But I think we're making a big deal out of nothing, that this idea of vitamin D levels being over 100 is terribly dangerous. Really, I don't think holds water. And talk to your doctor, but you may want to look at using higher doses of vitamin D. You may be surprised. One way I give my patients a lot of energy, I'll give them a vitamin D shot if they're feeling run down. And it's amazing how their energy comes right back. So look at vitamin D. It really is pretty cool.